A handful of major health bills just cleared a key deadline under the Gold Dome. And while health policy can feel complicated, a lot of these bills could potentially impact you on a very personal level. Rebecca Grapevine is joining us here from Health Beat this morning. She wrote an article breaking all this down on Health Beat. Rebecca, good morning. Great to see you again. Thanks for your time.
Good morning.
So let's talk big picture as you look at some of these bills and the ones that survived crossover day. Which should Georgians really be keeping a close eye on over these next few weeks?
Yes, great question. There's been a lot of action down under the Gold Dome on health this year, and I was thinking about which bills would impact the most people. Probably number one on my list is the one that would implement a cell phone ban for high school students in Georgia. I think we've talked before, there's already that's a law in place that's really going to take effect this fall with a bell-to-bell ban for K through 8 kids. And now lawmakers want to extend that to high school potentially. And that's up for a key vote in a Senate committee this afternoon, is my understanding. So that's one. Another one that I think is important is a measure to allow pharmacists to prescribe HIV prevention drugs. And that bill is very close to the finish line. There's some final technical changes that need to be approved, but lawmakers have really been in favor of that bill, and that could really widen access to these life-saving drugs that can prevent HIV. So those are two. There's more, but we can start there.
Yeah, let's start there. You got me intrigued with the cell phone ban. Why is that considered a public health measure, and what exactly are they looking to change?
Well, I had the same question when I first started reporting on this. And, there's obviously a debate, and evidence that shows that educational outcomes could be improved if kids don't have access to their cell phones. But lawmakers and parents, as you probably know, are very worried about the mental health effects of social media as well. And so the idea that, kids not having access to their phones during the day, that would improve their socialization, that it could improve their mental health, that kind of also puts it in the realm of public health. So that's a wide-ranging impact with that bill.
What about this bill allowing pharmacists to prescribe HIV prevention drugs? We've actually had you on the show before talking about some of your reporting on this. How big of a game changer could that be if it succeeds?
Well, it could be a pretty big game changer. People who support this bill say it's worked really well in other states that they've tried to implement it in. We know that here in Georgia, there are healthcare deserts in different parts of the state where you might even have to drive hours to see a doctor to get some of these drugs. Some people just may want to have that face-to-face interaction rather than telemedicine with a pharmacist. And besides the individual people it could help, it could also just raise awareness about these drugs and sort of normalize that taking these drugs and talking about HIV is okay because it's in your pharmacy, just like, every other sort of health issue under the sun, and just something to take care of from a health perspective rather than a stigmatized issue.
Rebecca, let's talk about some of the issues when it comes to doctor and nurse shortages that we face here in the state. From your reporting, are there any bills out there right now that address those issues?
Yes, well, there is one bill, and it's moving through pretty quickly here that would allow foreign doctors to practice in Georgia. Now, there's a long checklist of things that have to be done in order to do this. It wasn't just let anybody come in and practice. There's basically, they would have to meet all the same requirements that American doctors do. And they would have to agree to practice in underserved areas. So even if it didn't net, hundreds of more doctors, even if it netted some more doctors, it could bring doctors into areas that really, really need help. So that's on the doctor side. On the nurse side, there's a measure in place or being proposed that would allow nurses who are struggling with substance use to get some help for that without necessarily kicking off this long public disciplinary process. And I talked to a lot of nurses for that story, and many of them told me that they would have gotten help sooner, but they didn't want to go to rehab or get other kinds of help for substance use issues because they knew it would cause issues with their nursing licenses and their livelihoods. And so this bill kind of sets up a middle way where if a nurse gets help, it's private and they stick with the plan. then they're able to continue practicing without necessarily going through what can be a 5-year, very costly disciplinary practice. And so advocates say, hey, this would help us keep some more of our nurses in the workforce. And at the same time, it's the right thing to do because we're allowing them to get help earlier. And both of those are moving and have, I think, a pretty good shot of getting passed. But don't hold me to that. Anything can happen under the
Right.
Gold Dome.
Anything can happen. That addiction story is interesting to me. How do you balance getting them the help they need with also patient safety, since they'd be, as I understand it, still treating patients while they undergo addiction treatment?
Yes. Well, it's not like we would just be saying, oh, okay, well, you've done one thing to get addiction help, and so now you're back on the job. I mean, there would be ongoing monitoring of making sure they're sticking to the plan, sticking to the treatment plan. It just wouldn't be as public or as administratively complex. And obviously, if they fell off the treatment plan, then they do go to this kind of higher level of discipline. And on the flip side, I had some nurses say that even the current system, it's hard to navigate, but sometimes nurses can end up job hopping and, not having their records catch up with them and still practicing for a while under the current situation when they are in the throes of active addiction. So, there's a lot of competing factors to balance, but I will say that other states have programs like this in place that have been popular and effective.
Interesting. Rebecca, these bills we just discussed cross that major hurdle, literally on crossover day, but some other bills are kind of hitting roadblocks, right? You report on some of those. What are they?
Well, there was one bill from a Democratic lawmaker that would have sort of created a really much more robust maternal mental health program. And she was really excited because that was her first bill to get legislative approval, but then it didn't move forward ahead of crossover or after crossover day. And the same Representative Michelle Au has been pushing this measure to increase tobacco taxes in Georgia for years now. And in fact, there was a study committee that looked at that very issue, but those bills do not appear to be moving forward either. And Georgia has the second lowest tobacco tax rate in the country. So that's one where maybe in the future there could be action, but one lawmaker said nobody wants new taxes, even on tobacco. So it's not the most popular idea.
All right. Very good, Rebecca. As we step back and watch over these next few weeks, what are you going to be watching for, and what should folks at home be watching for?
Well, we've said these bills aren't moving ahead, but there's always sort of technical backdoor maneuvers lawmakers can use to get bills that appear to be dead back on the docket. And that requires somebody to watch really closely. So I'll be looking for that and I'll keep you posted. But I'm definitely watching that cell phone ban bill and measures to get the HIV drugs at pharmacies, and then these two bills about doctors and nurses. I mean, it's a lot. It's a lot of healthcare action under the Gold Dome this year. So I'll stay busy for sure, keeping track of all this stuff.
And I got to say, it's worth checking out her article on Health Beat right now. You can read it for yourself. She has it in bullet points, very easy to read, understand, digest some complicated health issues. Rebecca, you do a great job there. All your colleagues do as well at Health Beat. And we thank you for your time this morning.
Thank you.